Hi everyone, Dr. Fink here. Today we'll talk about testosterone gel and how well it is absorbed depending on the location you are applying it to. Quick disclaimer, this is not medical advice, this is entertainment only. So first let's look at how testosterone gel is absorbed by our body. So here I have a representation of our skin. So here we have the epidermis, so the outer layer of the skin, and now we have the gel containing testosterone, and below the epidermis, we have the dermis, and inside of the dermis, so we're still talking about the skin, we have blood vessels. So once we apply the gel on our skin, the testosterone molecules will travel through the epidermis, first pass this layer, and then pass into the dermis, where we have blood vessels. Once the testosterone hits those blood vessels, it is absorbed by the bloodstream and goes systemic, and we can use it in the rest of the body. Okay, so this is how testosterone gel is absorbed. So now here's the big question: which body part or which location of the body should you apply testosterone gel to make it the most efficiently available to us? There's a study that looked at 3 different locations to apply testosterone gel and compared the resulting testosterone levels in the blood. And I already wrote down the results. So 1 month of testosterone application of 50 milligrams per day of 1% gel led in one group 668 nanograms per deciliter, which is pretty good. It's maybe average high. And the second group 543 nanogram per deciliter, pretty average. And then 459 nanogram per deciliter for the last group, which is maybe on the lower average side, but all within the average. However, there's a big difference between the highest and the lowest group. So they compared shoulders and arms, chest and abs, legs and calves. So these 3 locations have been compared, and which one of those do you think led to the highest testosterone levels? It was the chest, the shoulders and arms. Second highest was the chest, abs, and the lowest was in the legs and calves. So why are there different results with regard to serum testosterone levels, even though they applied exactly the same amount of testosterone gel on their body? There are several explications. First, the thickness of our skin, so the outer layer, is usually thinner in the shoulders and arms, making it easier for the testosterone to penetrate, to be absorbed into the dermis. Okay, so that's one reason. Secondly, in shoulders and arms, the capillary bed, the small blood vessels, are very rich in blood vessels, making the absorption very efficient and fast. As we go to chest and abs or legs and calves, the skin gets thicker and absorption rate might not be as good as in shoulders and arms. All right. So this is basically showing us that even though we're using exactly the same testosterone gel, the same amount, depending on where we apply it, we are getting different levels of testosterone. And if you want the most testosterone out of your gel, shoulders and arms should be the best choice. All right, I hope you liked the video, and